Okay, we started the the recording. Stefan, I'm going to make you the presenter so that you can share the presentation. Can you? Okay, thank you. Well, good morning, everyone. Welcome to this informative session on the call for solutions the CHERRIES project has launched that will be open until the 15th of April. Today, project partners will present the three courses in three regions in Spain, Sweden, and Cyprus. I leave the floor to Stefan Philip, who will introduce the project and will give you more information. Just a quick note, the question and answer session will be held at the end of the webinar, but if you have any comment, please use the chat box. Stefan, the floor is yours.
Hi. Hello, everyone. Welcome to our Call for Solutions webinar. My name is Stefan Philipp. I'm a project manager and the coordinator of CHERRIES. I'm working at the Center for Social Innovation in Vienna. As you can see the slide with the agenda, I'm giving you a brief introduction about the background information and the processes about CHERRIES and in which context this Call for Solutions is launched. Before we are going to talk about the three different challenges that we are having, leaving some time for the Q&A at the end. I'm hoping that all the speakers will keep the time and we can stick to this agenda. CHERRIES is about responsible healthcare ecosystems. It's a Horizon funded project from the European Union. We are just starting the second year of the project. What is the background of CHERRIES? We see that there is a lot of pressure on the healthcare sectors, not only due to COVID, but also because of aging populations, comorbidities, chronic diseases that are putting restraints on not only the people, but also on the healthcare sector who have to deal with these issues, provide services to them. This is increasingly putting pressure on the sector that has limited resources, so there is a need to reduce the costs, while that's the expectation of the society, improve the quality, and thus innovation is seen more and more as a critical factor for organizations within the healthcare sector. But the one problem that we see is that often healthcare innovations, even though they prove that they are valuable, are not picked up on the market, and that there is a gap between good ideas and real uptake. And the hypothesis of CHERRIES basically is that we say, okay, if we make sure that the innovations are fitting an existing need, are co-created with the stakeholders so that they're really useful and fitting the environment and work life of the professionals or also the patients, then there's a higher chance that they are getting uptaken and could therefore mitigate this pressure, these issues. There is a process called Responsible Research and Innovation that's brought forward by the European Commission that is orienting towards these issues. It's an approach how you could innovate in this sense. And CHERRIES is building on that. What are we doing? We are doing these RI experiments in the healthcare sector in these three regions, in Murcia, in Örebro, and in the Republic of Cyprus. You can see here basically the experiment process. You start at the left side with the need identification. That's something that we did last year. We were going to our stakeholders in the regions and saying, okay, where do you actually see issues in the sector? We collected these needs. We are creating this call for solutions right now. That's where at the stage where we are. And then we will fund selected organizations to develop a solution. And I think many of you are here today because you're interested in these calls. Then this solution will be co-created with the people who actually identified this need in the first place in order to make sure that the solution fits the need. Then, of course, we have some kind of market expertise support from our partners that will you be able to access. And in order to make this whole process sustainable, like this is the first round, is an experiment, but we also want to make this sustainable. We are having a strength of work that is directing the environment, the policies that are in the sector to anchor these need and demand orientational approaches. As I said, we selected the needs. You can find them on the CHERRIES website. Call for solutions is there. All the documents that you need, you can find there. We have these 3 needs, one per region. In Murcia, it's about the progression of multiple sclerosis. In Örebro, involuntary loneliness of elderly people. And in Cyprus, it's about remote telemedicine solutions for rural areas. What do these call pages look like? Here's a screenshot from the Murcia call. They all have the contents of the challenge, why you should apply, who can apply, how the application process looks like, how the selection process looks like. We have an interface for questions, so like also contact details. You can as we will collect all the frequently asked questions there and answer them in a document that will grow over the time. So please have a look there, and you can download all the documents that you will need and find all the information on how to apply. Just let me lose another word about sorry, I just wanted to get the boxes out of my way so I can actually read my slides. Let me lose a word about RRI. What is responsible research and innovation? It's a transparent, interactive process by which societal actors and innovators become mutually responsible to each other with a view on the ethical acceptability, sustainability, and social desirability of the innovation processes and its market products. That's one definition from Schomburg, who used to work at the European Commission. So what it's actually about is really aligning new solution products, services, also processes and social innovations to the expectations and the actual needs of society. I think CHERRIES, the process that I lined out earlier, is per se an RI process, but we also expect that the solutions do this co-creation and respect these principles. If you don't know yet what RRI is, you can find the video library on the CHERRIES website, where we had already webinars in fall, where we also discussed RRI practices in healthcare, but also other topics. And we uploaded a deliverable of the project about RRI. It's a toolbox that is collecting, I think, 150 or even more practices that we consider as responsible approaches in healthcare. It's covering different aspects. It's also like ethics, gender equality, open access, public engagement, science education. These are all things that are standing in close connection with RRI. Have a look at this toolbox. It's a great resource and can be a potential inspiration if you want to submit a proposal for a solution. I pasted the links to these 2 things on this slide. It will be available afterwards, but you can find it on the website. Just briefly, the process, key dates. We have a deadline that is the 15th of April. Then we will go to the evaluation process. We will invite the best ranked solutions for hearings. Then we will have a notification and the contract process during May, so that the co-creation processes can start in June. They will run for 10 months. So we expect them to finish in April. On the right, you also see the evaluation criteria. For the solutions, this is the example of Örebro. There might be minor changes in other regions, but basically we are looking at how the challenge and potential impacts fit the solution fit the needs, if the work plan is viable, how the sustainability of this solution looks like, and then we have a responsible research and innovation criteria that is more as a tiebreaker in case we have equally ranked proposals. Even though the co-creation process per se is also an RRI process that is not a tiebreaker. With this, I would point you towards our social media and website. If you have any questions, you can get in contact. You find the regional representatives of CHERRIES on the website, and they know the regional calls much better than I do. Just get in touch. We are here to help you. Thank you. And with this, I would like to hand over to Moises, if I'm not mistaken. Yes, Moises.
Not mistaken. No.
Good morning, everyone. Is my screen available?
Not yet.
No, it is.
Now it is.
Good morning from Cyprus. From Cyprus, everyone. It's a great honor that you have joined us for today. Together, it's me, Moises, representing the Cyprus Research and Innovation Center. We're a fully BN member in the Business Innovation Center of Cyprus, and also with our partner Stelios, representing Areteion Hospital, a leading healthcare provider in Cyprus. The name of our local call for solution is the provision of medical services to Cypriot citizens that live in rural and remote areas. At this point, it would be very significant for me to state that this is the first time in Cyprus that we incorporate the term responsible and the process of co-creation in research and innovation in the healthcare sector. This is a milestone for us, and we consider it very important. I would like to start the presentation with some significant key points from the region of Cyprus because they connect to the challenge and, of course, the need that led to the challenge. So we are a country that is an island. So that means that we have the cities, the capitals, the cities in the coastline, and Nicosia, which is the capital in the center of the island. We are talking about a population of less than 1 million, with a density of 94 inhabitants per square kilometer. That means that we have communities that are with high scarcity around the island, not only people that live in the coastline or in the major city centers, but also all over the island. This is very important for us because it is estimated that more than 40% of the population living on the island lives in rural and remote areas. That means that lives relatively far away from the major healthcare providers of the island. Another important statistic for the region is that Cyprus spent below the average of the EU based on the 2017 statistics in health per capita on a percentage of the GDP. So, leading from the regional, let's say, statistics, the purpose and the reason we filter from the need of e-health solutions is because we need to provide accessibility and quality of medical services to the communities that have no easy access to medical centers and healthcare professionals, and they need to travel and spend commute time and cost to visit the obvious, the healthcare, professional healthcare. This includes specialized categories also, such as elderly people with chronic that are chronic patients, people with disabilities, and other relevant medical conditions.
Good morning. Yep. Good morning, everyone. Örebro Hospital, as a leading healthcare provider on the island, offers a wide spectrum of services to the citizens. We are a private hospital. We joined recently the national health system. And what is shown to you right now on your screens is what we are currently doing in parallel of joining the national health systems. We managed to have more than 12,000 emergency visits, more than 14,000 X-ray exams. The rest of the statistics you can see on your screen.
So, apart from this, during the COVID-19 measures, we all have seen these images of people standing in long queues and crowded hospital areas and crowded other common spaces of the healthcare providers. We have seen elderly people that need day-to-day care or other people with disabilities that have no access to the healthcare provider. Plus, due to the COVID measures, they couldn't even move to the healthcare providers. The reason that we came with the e-health solutions is because we want to turn the previous image to this image. We believe that we want and we can make the life easier both from the provider's perspective and also from the payer's perspective. We want to make the life easier also for the patients, but also from the healthcare providers. So we could turn the previous images into something like this.
I showed before some statistics that the Örebro Hospital has served to the citizens. But what about the people that cannot visit healthcare professional due to some reasons? As we know, as a hospital, there is a large portion of the population where we cannot provide our services. We identify some indicative ideas and potential challenges that need to be solved, day-to-day problems that need immediate and practical solutions. And these are the problems of each citizen that lives away from the cities and is facing, not to mention any community cost that comes with this. We will try to be as descriptive as possible in order to help everyone understand what we are trying to do. These, of course, are, let's say, guidelines and not prerequisites to be used for the proposed solution. We're looking for a solution for the isolated people and the people in rural areas, which will help them to get the same quality of medical attention like everyone else. At the same time, we want to help and encourage the health professionals, the doctors, to use and expand their diagnostic capabilities virtually. A great example is the current situation with COVID, because this solution, when deployed, will minimize the risk of infection. And by using this methodology, we can minimize also the exposure for healthcare patients and staff. We can free up resources by saving time, and we can even save equipment like gloves, masks, gowns, etc. Some ideas we wrote down and discussed, I'm sharing with you today. We want to take the patient visit workflow and put it, let's say, in a virtual doctor's office with live video, broadcasting, chat features, maybe even auto captions, medical terminology, explanations in plain language. Whenever is needed, of course, a physical presence of nursing staff will be present. All the above should be working in parallel with templates for the virtual clinical examination session that are best suited for the doctor specialties we are going to choose based on statistics that will help us identify which are the most demanded medical services this group of people need. Of course, this will be a pilot, but having this as a core in the future can be expanded anytime according to demands of patients. Another feature we're looking into is appointment booking availabilities of the doctors who are going to be enrolled on this platform. To accomplish this, the proposed solution must be connected to their personal medical calendars and software, for example, through APIs. It should identify the free slots of a doctor, so the remote patient can book online through the app their virtual appointments. The case also of group supporting meetings is interesting. This goes more to patients who are, let's say, in isolated areas and is hard or not allowed to travel due to different reasons. So occasional group supporting meetings will mean a lot to them, so we can work a bit on this part also. Starting from physiotherapy, exercise, these sessions can be arranged where patients should be provided with various exercises to keep healthy and in shape. Physiotherapy is also important for post-surgical patients, especially having to do with orthopedics, neurology, and neurosurgery in order to recover from surgeries. We even can include radiological and clinical laboratory results to be entered into the patient portal with an interface which will make the app communicate with our hospital information, laboratory, and radiological information systems, and transfer medical data into the patient's digital record. Emergency information can be available in this app, like in case of a patient is not feeling well and he or she taken to hospital or clinic or professional or a healthcare professional, information like blood type, allergies, chronic medications the patient is taking, a brief medical history which is important for the doctor, and also the personal doctor's information, emergency numbers to be contacted. Related to this point is an SOS function, let's say, which can be applied with the help of a GPS on the mobile device the patient is using, an ID of the patient that is linked to that SOS function. The geolocation of the patient can be sent to the treating doctor for the next actions, which can be used to send, for example, an on-call nurse to the area or notify an assigned emergency contact by the patient for a physical visit to check on the patient. All of the above, of course, we do not expect on an all-in-one solution. These are potential ideas which are going to be under the umbrella of a secure and GDPR compliant system for storing medical information, consultations, treatments, follow-up, and prescription. Thinking a bit further would be to give the patient and the doctor the facilities to share their medical record, the medical record of a patient with other treating doctors. Yes?
Stelio, sorry to interrupt you. We are running out of time, so I kindly ask you to come closer to the end. Okay, thank you.
This is just to highlight that the large proportion of the population that currently contributes to the national health system has to receive the same quality of medical services that people that live in the cities receive at the same time. So the potential benefits during and post the co-creation for every applicant in the call for solutions would be to develop an impactful and responsible solution for the citizens of Cyprus that eventually could be replicable to the mirror territories. We want to lead by example for other solutions in the future to come in the healthcare sector, and we are able and willing to provide full support, both from the hospital with healthcare professionals, also from CHERRIES in research and development, and also from our incubator at CHERRIES for business continuity and adoption of the proposed solution. We are very enthusiastic for this project, and we are looking forward to receive applications and we're happy to answer to any questions that you might have.
Thank you, Moses and Stelis. Well, the enthusiasm can be felt somehow at distance. Thank you. Now I'm going to give the floor to Gorka, who will present the challenge in Murcia, in Spain.
Thank you.
Okay, Gorka, welcome.
I am going to share my screen.
Yeah.
Can you see?
Yes, we can. Thank you.
Okay. Thank you. Good morning, everyone. My name is Gorka Sanchez. I am responsible of innovation in Servicio Murciano de Salud. It's the health agency in our region, and I will introduce our challenge in CHERRIES. It's about early detection of progression in multiple sclerosis, and this is the reason why it's called progress. The objective of the challenge is to achieve the early detection of the progression in multiple sclerosis, applying sensors to patients using the Internet of Things, beyond the current face-to-face visit with our neurologists and nurses every 6 or 12 months. The need is to shorten this delay of detection of multiple sclerosis progressions, which is estimated by papers and studies in 3 years. The methodology of the challenge is a prospective study with at least 30 patients during 5 months. And the challenge team is composed by local association of patients of multiple sclerosis, the Department of Neurology in the Hospital of Cartagena, it's the city in the southeast of our region, and the Department of Biomedical Engineering in Polytechnic University of Cartagena. I think it's a very good approach, RRI approach of this challenge team. And this is the co-creation timeline. We have 2 different phases for in total 10 months. The first phase is the co-creation. You can see in the pink color we have 2 different prototypes with 2 different levels of maturity. And the second phase is the pilot testing with 5 months and with 30 patients with in total 150 days. And the solution will have to record the data of these 30 patients involved continuously and simultaneously during this period. And what about our requirements? We have 2 different kinds of requirements, compulsory and optional. The compulsory are these automated patients data recording service with the wall approach. And the components, the main component is the digital actigraph. And we are not looking for a sophisticated smartwatch. We are looking for a simple and robust smartband and all the cloud services around this. Gateway, application, storage, viewing modules, management and maintenance modules, etc. And optional requirements, among others, we have working, for example, presentation of the working data by section or distance to home by geolocation or location of patient with the different rooms of the home, or distinguishing the working and static periods, or heart rates, or labeling different sleep periods, or the internal memory of the device, for example. You can read a lot in the call in the web. And finally, about our business opportunity. The target population that the multiple sclerosis affect 1 per 1,000 inhabitants in the world, and in our region is about 1,500 patients. And it would be the solution. It would be applicable to any progressive degenerative neurological disease like Parkinson, which has more than double the prevalence of multiple sclerosis. We offer to the companies advice of business model, commitment to managing a bear case, in case of the success of the pilot experience, and dissemination of the results with the support of clinician and patient association, and collaboration with the study of cost saving, as well as with its publication and dissemination. We have a long experience about co-creation. This experience is looking for your company. We are waiting you. Thank you for your attention. This is our mail for questions. Thank you.
Thank you very much, Gorka. Well, after Spain, we are going to Sweden. I'm going to give the floor to Lena, who will present the challenge. Just a second to give you the right to be presenter. Okay, you should now be able to share your presentation. Okay, we can see.
You can see my screen?
Yes, just making a presentation mode. Perfect. And then we can go ahead.
Thank you. My name is Lena Uvhagen. I am working as a development leader in public health in the region of Örebro County. And with me today, I also have Märta Lundqvist, representing the healthcare of the region. And presenting the call for solutions in Örebro, breaking and preventing involuntary loneliness among elderly. So the region of Örebro the county is found in the southern Sweden, and it consists of 12 municipalities, and 3 of those municipalities is the focus of this call and this project. We have Karlskoga with a population just over 30,000 people. Degerfors with a population over 9,000 people, and Laxå with a population over 5,000 people. And so this is 3 rather small municipalities. Each municipality is responsible for healthcare to the elderly in their own homes, and also responsible for care homes for elderly. While the region is responsible for the health centers and the hospitals. So we have a shared responsibility when it comes to the healthcare in Sweden. Looking a little bit closer on these 3 municipalities, we see that a quarter of the population is over 65 years old, and almost 10% are over 80 years old. And of course, in Sweden, as in many other countries in Europe, we have an increasing elderly population. 88 out of 100 are living in their ordinary home without any kind of municipality service. And almost half of the population over 65 are living alone, which we know is a risk factor both for involuntary loneliness and also for mental ill health. So description of the need, breaking and preventing involuntary loneliness among elderly. We know that long-term loneliness could result in self-isolation, both from social contacts that we have had earlier in life and also from society in general. We also know from research that elderly often do not want to be a burden to family and to society, and therefore there are expectations and the hope that other people will make contact. So the conclusion is that we know from both from research and from experience that people with the greatest need for social contacts can be very difficult to reach with the various kind of efforts that aim to break the loneliness and offer social contacts. So this is a challenge to reach the people that are most in need of this kind of measures being taken today. There are different kinds of loneliness. We talk about existential loneliness, that we feel that we have no one to share our innermost thoughts and feelings with, and that no one really understands us deeply. And we have social loneliness, meaning that we lack friends and acquaintances with whom we can share our daily life. And also we have emotional loneliness, meaning that we lack a partner that we can also share our life and our feelings and thoughts with. Loneliness can be voluntary or involuntary. It can be objective or subjective. The important thing in this call is that we focus on the involuntary loneliness, and also that the feeling of loneliness is more important than the actual loneliness. So we target people who feel lonely and do not want to be. So the opportunity is to pilot an innovative solution to meet the need of social contacts among involuntary lonely elderly. The solution can be of various kinds. It can be a product, for example, a new technical solution, an app or something like that. It could be a new kind of service, and for example, a new kind of social activity. And it could also be a new process of some sort, a new way of doing things, for example, a new collaboration to reach the target group. It could also be a combination of 2 or 3 of these different types of solutions. We also offer co-creation with healthcare professionals, both from the municipalities, the hospital, and from healthcare centers. So what are we looking for then? We are looking for a solution created together with the target group, meaning the elderly, and or healthcare professionals that often meets those elderly people. We are looking for a solution that offers social contacts and that does break and prevent involuntary loneliness. We are looking for new ideas on how to reach the target group, meaning the people that are often hard to reach with existing activities. We are all looking for solutions with the potential of sustainability and upscaling, solutions that can be replicable in other parts of Sweden and of Europe. And the solution needs to be carried out or offered in these municipalities that I mentioned earlier in the western part of Örebro County. It doesn't need to be all of these municipalities, but it needs to be carried out in at least one of those 3 municipalities. So that was all of the information I had today. Please contact me or any of my colleagues for further information, and we are happy to answer any of your questions. Thank you.
Thank you, Lena. Thank you all the speakers who intervened today. Now I would like to open the floor to any question from the audience. Please feel free to write your question down or to activate your microphone and have a chat with our speakers. I don't know if in the meantime any of you would like to add something. Stefan, Moises, Gorka, Lena, or your colleagues who joined the session? No?
No, I would just like to thank all the speakers here present for now. Thank you for the presentations. Thank you for presenting those needs. I think just a short recap, it was really a very interesting and intense process in the fall to collect the needs. It was not an easy decision to put those forward. I also think there are really important cases that have business models outside of the region that we are having now. It's also like it has been mentioned but not introduced by myself. We will expand this geographical spread of cherries in the second part of the project. We will go beyond these 3 regions and include further regions and support them in introducing similar processes. We have a broad range. I think multiple sclerosis in Murcia is very detailed what is expected. We have a clear target towards e-health solution in Cyprus with a list of requirements that are expected, hoped for, and we have a very different kind of problem, a very wicked kind of problem in Sweden that is very relevant in our aging societies. This is how you can engage with elderly people who are not as mobile anymore and who are suffering at this situation. So we are really looking forward to a broad range of solutions, to your creativity in addressing these issues, and yeah, looking forward to your approaches to them. And with that, I would again ask you if you have any questions, you're more than welcome to ask them now. Otherwise, you can always contact us via email, or I think other people are also taking requests via phone. I see Miriam is raising her hand.
Yeah, I mean, I just wanted to back what you have just said, Stefan. I know sometimes when we present like the challenges, it is not that easy to understand what we want to achieve. I would really advise all the participants to go through the challenges that are published on our website. And if you have any question, there is an email where you can address any question that you may have. What I suggest is do it as soon as possible, because that will allow us to produce like a really thorough explanation to your questions. If you address your questions like 1 week before the deadline, it is going to be a little bit more challenging just to answer you in time to incorporate that question. So we are more than happy to provide information. So yeah, go through the challenges. They are all on the website. And yeah, we are happy to further explain any question that you may have.
Thank you, Miriam. I don't know if there is any question from the audience. Please activate your microphone. Feel free to ask. Otherwise, as Miriam was saying, you are warmly invited to check the CHERRIES website and to contact the available email address for any question you may have. Okay, I assume that we don't have any question from the audience. So again, I would like to thank you all for participating and for giving your contribution. And also, we look forward to receiving several innovative ideas to meet these challenges. Thank you.
Thank you.
Thank you.
Thank you.
A nice day to all of you. Bye.
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 Bye. Thank you.